Health is the compass that guides through the uncharted waters of life, ensuring our journey is steady, vibrant, and full of possibilities. Good health is a state of well-being where your body and mind function optimally, allowing you to perform daily tasks, pursue activities you enjoy, and maintain a high quality of life. If you yourself dealing with a failing health, it can be challenging and concerning experience. Failing health typically refers to a decline in physical and mental well-being, which may affect your daily activities, overall quality of life, and potentially require medical attention. Today, we have a unique topic on exploration of infusion therapy, a medical technique that plays a crucial role in delivering fluids, medications, and nutrients directly into your bloodstream. From specialized treatment to routine hydration, infusion therapy encompasses a wide range of applications that contribute to the patient well-being. In this session, we will delve into the mechanisms, benefits, and diverse scenarios where infusion therapy provides to be an essential component of modern healthcare. Well, join us as we journey into the realm of infusion therapy and uncover its significance in improving and sustaining health. For my Medicare segment, I will be shedding light on the ins and outs of Medicaid, a vital healthcare program that serves millions across the nation. We'll dive into the benefits, eligibility criteria, and how it differs from other healthcare programs. And of course, for my Medicare Q&A, I will answer Medicaid-related questions. And of course, for my Healthy Senior segment, I have a short video on some tips on how to promote healthy aging. So, no matter what state are you from or what work you've done, you must transition to Medicare at a certain point in your life. MariaCares has a mission to bring Medicare information right to your home. I'm your host, Maria Garcia, a licensed sales agent, always available to assist you with your Medicare and other senior concerns. We are broadcasting in the wonderful city of Las Vegas, a place you would like to be in, especially when you retire. So come on, let's join hands to a better health.
Are you passionate about making a difference in lives of seniors? Join our team and be part of something meaningful. We specialize in providing health insurance to seniors and individuals on disabilities. Our mission is to improve lives and ensure access to quality healthcare needs. When you join our team, you open the door to endless opportunities for personal and professional growth, with a possibility of making six-figure income annually. We believe in investing in our employees and helping them reach their full potential. At our organization, we foster a supportive work environment and a collaborative culture. We believe in teamwork and value the contributions of every individual and give all the support necessary for you to achieve your goal. Ready to start your journey with us? Contact Maria Garcia at 310-926-4229 to learn more about the exciting opportunities waiting for you. Your age is not an issue, your compassion is what counts. Call or text Maria Garcia at 310-926-4229 for current job openings and take the first step towards joining our team. Remember, possibilities are endless when you join our team.
Welcome to Secure Your Loved Ones. We will show you how a final expense policy can provide financial security for your family. With a final expense policy, you can have peace of mind knowing that no medical exam is required, regardless of your age, illness, medical history, or incarceration. In addition, our final expense policy includes a free accident benefit rider that doubles the policy amount in case of accidental death. We understand the importance of honoring your loved ones without breaking the bank. That's why our final expense policy includes funeral negotiators who work to get you the lowest costs possible. Not only that, but you'll also enjoy a 30 to 80% discount on funeral merchandise, including a casket with a locked-in price of $2,000. Secure your family's future by choosing a final expense policy. Don't leave them burdened with huge unpredictable expenses during a difficult time. Call Maria Garcia at 310-926-4229 to learn more about how a final expense policy can provide financial security for your loved ones.
Welcome to our discussion on infusion therapy, a vital medical treatment that involves delivering fluids, medication, or nutrients directly into your bloodstream. In this discussion, we will delve into the intricacies of infusion therapy, exploring its various applications, benefits, and the conditions it addresses. Whether you're new to this concept or seeking a deeper understanding, join us as we unravel the world of infusion therapy and its significant role in healthcare. With me are experts in the field of infusion therapy, and they are the owners of eMediate Infusion Center. With them, I can truly say you're in good hands. I am pleased to welcome Christian and
Ronald.
And Ron de Guzman. Yeah, please introduce yourselves.
Hi, my name is Chris. I'm partly owner of eMediate Infusion.
And my name is Ron. I'm partner with Christian, 50-50.
Half and half, huh? So, gentlemen, what exactly is infusion therapy and how does it differ from traditional oral medication?
Okay, infusion therapy involves the administration of medication, fluids, and other therapeutic substances directly into the bloodstream. Via typically using an IV intravenously. This method allows for a rapid and precise delivery of the treatment, bypassing your digestive system. It differs from traditional oral medication in therapy. It involves medication fluids and other therapeutic substances.
Oh, I see. So, I mean, it's more effective to digest it because it's through the vein.
You're right. It bypasses those gastric juices. So typically, when you take medication via mouth, it gets to your stomach, gets digested by the acid, and then the efficacy and the potency of the medication is way less versus one directly inside your vein.
Oh, yeah, because there's a lot of things involved in the digestive system.
You're right.
Okay. So another question, gentlemen. What types of medical condition or illness can be treated with infusion therapy?
No. Infusion therapy can be used to treat a wide range of medical conditions and illnesses, including autoimmune disorders such as rheumatoid arthritis and lupus, cancer, infections, gastrointestinal diseases such as Crohn's disease, neurological disorders such as multiple sclerosis, dehydration, and more. It can also be used for pain management, blood transfusions, nutritional support, such as hydration, even vitamins.
Oh, even vitamins, because if they're not digesting the vitamins properly, might as well through the vein.
Yes.
I see. So I don't know who's going to answer this. Can you walk us through the process of receiving infusion treatment?
So the following steps are: patients are going to be evaluated to be determined the proper treatment and dosage that's going to be coming from their doctor, specialty-wise, neurology, GI, and pain management and different stuff. So the next step would be the clinic would be sending a prescription to our clinic, and then we will find a pharmacy that can fill and do a prior auth for those said medication, and then they would set an appointment date with us. Then coming to our clinic, we would then process patient's information, and then they get to meet the staff and then the nurses while we review their chart, And after that, we take their vital signs, access their vein via IV line, and then we start administering the medication. And the medication administration is typically infused as fast as 5 minutes to an hour to 6 hours. So it depends on the duration of the medication itself. And then we do monitor the patient closely after the infusion, and we watch for any adverse reaction. And patients are instructed and educated on what to report, such as minor itching, rash, and other signs and symptoms of allergic reaction. So post-infusion care, after infusion, they can be monitored in clinic within 30 to an hour, or they can be monitored at home, and then they can go to post-care if needed.
So, this procedure, do you do it every time they do infusion or just on the preliminary just to find out if they have allergies?
So typically the first few doses, we do recommend the patient to stay for 30 to an hour for us to monitor them. In case any adverse effect happens, we are ready to accommodate and take care of the patient at that point in time.
So in other words, we take safety precautions, especially if the patient had never received the medication before. So we have to take precautions as far as like watching for allergic reaction. So the infusion itself, we have to slow it down, make sure that it's not, an initial, especially an initial dose, it's a lot slower, and we have to monitor almost every minute. We have to keep an eye and make sure that the patient understands what allergic reactions are we looking for. And we work closely with the patient one-on-one, especially in those cases. But on other infusion where the subsequent infusion, that's where we are more confident that, all right, you're okay in the first infusion, then we should be all right in this, and then we can shorten the time infusion, and patient love the fact that they can get in and out of the clinic. And then usually 3 to 5 sessions. And so in other words, from referral to infusion itself, from the initial referral, we can kind of accommodate the patient within the span of 2 weeks. That includes a prior auth, that includes the medication being processed by the pharmacy, delivered to us, calling the patient, scheduling them, and then infusing them. And then after that, any subsequent infusion will be a lot easier because all of these are done. We're just taking vital signs, making sure that they're stable.
Oh, I see. Is there an overdosing also with that kind of procedure?
It's a very good question. Any procedure can have an overdose. That's why we have our own protocol. For every medication has their own protocol. Our clinic has their own protocol, meaning on top of what they provide us, we also follow certain policy in our clinic that we cannot break, meaning for safety net, we have to follow theirs and we have to follow ours, whichever is safer.
Yeah, so it's like And on top of the guidelines, you have more,
You're
more
right.
guidelines.
And more, I would say, stricter guidelines.
So typically, pharmacy would calculate the dose based on the doctor's order, but once the medication gets to us, we recalculate and double check the dose to make sure that correlates with the patient weight, because most of the time it's weight-based medication.
Yeah.
And this is where we actually factor in the fact that have you had this medication before? These are the questions that we have to ask. Or this is your initial one, or do you have any allergies behind all this? Other medications that might be related to what we're giving. So all of this, we need to make it part of the assessment.
Yeah, the body weight is very important because the thing is, I mean, that's the time the overdose kicks in.
Right, things can change from the initial dose. The weight could have changed. The vital signs could have changed, especially the blood pressure. Some of this can affect the heart rate. We have to watch the blood pressure. Certain medications that they might have changed before, after the initial dose, the second dose, all of a sudden they change the medication regimen. We have to take that into account.
Yeah, and especially what if they are stressed, they have anxiety, then you put the...
Then you will see that in the vital signs. That's why there's a lot of interactions between the patient and the RN, the nurse, us. It's very important for us not just looking at the numbers. We have to be talking to them.
Yeah,
Somehow like getting a feel of like, how do you feel now? It's like, how, you know, are you stressed out? I mean, what's going on? We go to a personal level.
And besides, good thing you offer this VIP rooms wherein they have their own privacy.
You're right.
Right.
Yeah, because sometimes they get stressed when other people are there and then they don't feel comfortable.
They love that fact that it's very private. The whole session is private.
That's good.
Yeah.
Yes. So, by the way, how safe is infusion therapy, and what measures already mentioned that are in place to ensure patient comfort and well-being during the treatment?
So infusion therapy is generally safe when administered by qualified healthcare professionals. That's why this is only done by registered nurses. Measures are in place to ensure patient comfort and well-being, such as proper vein selection using sterile equipment and monitoring vital signs during infusion. Nurses and medical staff are trained to handle any potential complications. So this is where our experience comes in.
Yes.
We've been in the field for, I would say, 20 years or so.
Oh, wow.
So we kind of like have a feel right away. Patient coming in doesn't have to take vital signs. We kind of like get an idea right away whether they're in the mood to have some kind of session, or medication wise, or if something is off, we kind of like get into that and say, ask the right questions. And this is very important with the assessment. Especially the medications that we infuse are very sensitive. This is not just simple vitamins or hydration.
Yeah.
These are specialty medication, very sensitive.
Yeah. That's why, folks, it's very important. Just like he said, they have 20 years of experience, wherein, just like you said, Ron, when you see the patient, you already know.
We can tell, yes.
You can already
definitely
tell because of their long experience. So, are there any potential side effects or risks associated with infusion therapy, and how are they managed? I already asked that a little bit, but kindly expound on it.
So any medication has a potential side effect, especially infusion. Depending on the medication being administered, common side effects can include, obviously, allergic reaction, changes in blood pressure, fever, chills. But healthcare providers like ourselves are fully equipped to manage these side effects, and we can adjust the treatment as needed. Like I mentioned earlier, there are protocols in place. Such an event happens, and we are fully experienced to handle those kind of events.
So you mentioned that chills and others. So which one would show first when you feel that something's wrong with the patient?
Again, depends on the medication, but most of the time it could start off with a simple headache.
Headache.
Right. Prior to the infusion, we explain this to the patient. If you experience such and such, you make sure they have a call light that can alert, the nurses, so we can go to their room and then we can do our assessment. And if needed be, we can stop the infusion or slow it down. And then we do have a protocol in set. In case of a severe allergic reaction, we can administer medication to kind of slow down the reaction or, help the patient,
So let me just add to that. So every medication has their own sets of side effects.
Yeah.
But of course, every individual has their own unique
different reaction.
Yes.
possible reaction that might not be in part of that list. So what's important is how the patient present to us before the infusion, and the main thing is that if there's any changes in how you feel, any discomfort at all, forget about the list. It's very important that they do understand that something's off. You don't even understand what it is. Then
Let us know.
Let us know. That's the safety net.
Oh, that's good. So, I mean, how does infusion therapy offer advantages over other treatment options in terms of effectiveness and speed of recovery?
So, infusion therapy can offer advantages over other treatment options by delivering medication directly into the bloodstream. That's concentrated. It goes straight to your system. You feel right away the effect of it. And that's the reason why they came up with this IV infusion only. Because once you take it differently, most of the time you don't get the 100% effect of it. If I take, let's say, for example, Tylenol, I would say that you don't get the full, let's say, 500 milligrams of Tylenol. You don't absorb the full 500. Some of them, it comes out as a urine in through your urine, or some of them just comes out some in other ways, but it doesn't get absorbed fully. Now, bloodstream is kind of like, I would say it's like 100% of it goes into your system, and it's fast. And that's the reason why it's very effective. Now, as far as safety is concerned, that's why we follow all these protocols, because of that rapid effect. We have to be aware of what are we looking for.
But in terms of side effects, like for example, those painkillers, so like they have side effects sooner with the blood or sooner when they digest it? The side effect, because I know that it has a side effect for the kidney. So those pains. So I mean, is this lesser side effect when it goes through the blood, or it's lesser side effect when you digest?
Let me just answer this in general.
Okay.
So medications that you take through the mouth goes through certain organs, gets filtered and stuff like that. So when it comes to bloodstream, it bypasses some of these organs.
Yeah, that's good.
So that's like a safety net in
that's
a
why
sense.
it's good to know.
Right. So, but it all depends on which medications we're talking about. So there's a wide range of medications. So it's very specific. We do explain it to the patient though what we're dealing with and what we're looking for.
That's good. So, gentlemen, for patients who may be hesitant or unsure about trying infusion therapy, what would you say are the key benefits or success stories that might convince them otherwise?
Okay, so some of the key benefits of infusion therapy includes faster onset of action and higher drug bioavailability, like Ron was saying earlier. The one that you take by mouth or IV, okay? And it's better control when it comes to overdosing because it's per weight base, okay?
Yeah.
Success stories, I've had one where I had this patient, actually this is very, very special to me. She came into my clinic, or to our clinic, we used to infuse her. She had Crohn's disease. She was skin and bone, okay?
Wow.
She was refusing treatment because she already had given up. And then so we explained to her, hey, try this treatment for the next 6 months and see what happens to you. And to cut the story short, I met her, or I saw her again 6 months later. Guess what she was doing? She became a model.
Oh, wow.
Yeah, I could not recognize who she was. It's amazing. One of these days, I'll message her. Maybe I can have her on Instagram and show pictures. Yeah,
that's good. So you were the tool.
Yes, I would say I'm very proud that we
help.
were able to help her out.
Yeah.
You know, now she helps out the community on her IG page. She posts stuff regarding Crohn's disease to help other people or patient that has Crohn's. Okay.
Oh, that's good news.
Yeah, and to add to your question, you know, it makes better diseases management compared to other treatment methods. Okay. And again, it all depends on the severity and type of the disease. Majority of the time, IV medication would work better and faster.
I see. So, what advancements have been made in infusion therapy in the recent years, and how do they improve patients' outcomes?
Well, advancements in infusion therapy include improved infusion pumps. Pumps nowadays are a lot smarter, I would say. A lot safer. Better vein visualization techniques. That means we can see right away if there's anything going on with the site, especially. And the development of new medications and treatment protocols. These advancements have led to increased treatment efficiency, reduced side effects, and enhanced patient outcomes. So all of these medications goes through a lot of trials. Before it even gets to our clinic, it has to go through FDA especially. It needs to be approved. Not only that, these are fully tested. We don't. I think we are the first one who'd be hesitant to actually give it to a patient where we've never encountered this medication before. So we need to do more research, due diligence before we because we need to understand what we're infusing. And we have to make sure that the patient actually understands what they're getting and what to expect.
So, I mean, just like you said, it's through the bloodstream. What if they're taking some medications that's contraindicated to that kind of...
Yeah, very good question. Before it gets to the referral process, the referring doctor, their main doctor, or the specialty doctor actually filters out all of these questions. But it doesn't hurt for us to ask the same thing and have our own research, and based on our research, we have to ask the right questions on what medications they're taking, that there's possible contraindication of what they currently take.
Oh, okay, that's good. So, are there any lifestyle adjustments that the patient need to make while undergoing infusion therapy, and such as dietary restrictions or activity limitations after the procedure?
Yeah, majority of the time, lifetime adjustment during infusion therapy may vary depending on the individual's condition. Some treatment would require them to be at home all day, because they do some of this medication do require
Rest.
You're right, because some of them makes them feel tired, right? Some medication have a specific dietary restriction, while others may require adjustment to daily activities, exercise routines. It's actually important to patients and to discuss any lifestyle changes with our healthcare provider. But most of the time, they come in, we do the infusion, they go out with happier and with more energy.
But sometimes they have delayed reaction. That's why they have to stay at home, right?
You're right. The delay reaction comes in play. If it's a severe reaction, they are directed to go to the hospital. Urgent care if it's minor. If it's something severe, of course, if you cannot drive, they can call 911, okay? But if they're able to take themselves with, minor reaction, urgent care, again, like I said, otherwise, emergency room is highly recommended.
So in other words, after the infusion, there's a lot of time that we allow the patient to actually stay in the clinic for observation, just to make sure that they don't react. I mean, we follow certain protocols for each medication. Now, if they do happen to get discharged and we didn't see no problem at all, we feel like they can go home safely. And like what you're asking is, what happens to delayed reaction? We give this as part of the discharge instruction. What to do, what to look for, and where do you go?
Yes. At least in first aid.
Yeah.
Exactly.
So how does infusion therapy fit into the overall management of chronic conditions? And is it typically used in combination with other treatments?
Infusion therapy can be a vital component of a chronic condition. Chronic condition management, often used in combination with the other treatments like oral medications, lifestyle modifications, and physical therapy. All of these are being studied on as they trial the medication. Well, some of them are very more effective given with other medication in combination, and some of them are solely given because of the possible interaction to others. So these are all considered when they were testing the medication. So in our case, the only thing we could do as an infusion nurses is that we have to do our due diligence to do the right research and to find out exactly the studies about this medication. Aside from just talking to med reps, the medication representatives, the pharmacy representatives, but they're in close contact with us, and with all the literatures that they give us, it's pretty much we are very confident about,
That's
the
good.
infusion.
And plus your experience,
You're
20
right.
years.
And
Yeah.
to add on that really quick, when we receive new medication that would never infuse in the past, we do require pharmaceuticals or rep to do a teaching to us. So we meet with them, or they come to the clinic and they bring their brochures and they teach us how to infuse and what to watch for when it comes to what medication it is.
Yeah, especially those new medications. Huh?
Yeah, because every day there's something coming out.
Yeah, yes.
Yeah.
So, what do you see as the future of infusion therapy, and how do you envision in evolving to benefit patients further?
The future of infusion therapy could involve further advancement in personalized medicine. Like I said earlier, every day something new is coming out. New biologic therapies, more targeted delivery methods, some enhanced remote monitoring, and now there's telemedicine option that might be also become more prevalent, providing patient with greater convenience and access to care. As medical science continues to evolve, infusion therapy is likely to play an increasingly important role in improving patient outcome and quality of life.
Oh, that's good to know. So, as we conclude this insightful session, we extend our heartfelt gratitude to our esteemed guests, Christian and
Thank you.
Ron,
Thank you.
co-owners of eMediate Infusion Center. Their expertise and dedication in sharing information about infusion therapy have shed light on the crucial aspect of healthcare. We're grateful for the valuable insights they've provided, ensuring that we're better informed about the benefits and importance of infusion therapy. Thank you once again to our guests from eMediate Infusion Center for enlightening us with their knowledge and expertise. Thank you very much.
Thank you for having us.
It's a pleasure.
It is a pleasure.
Thanks.
Are you in need of infusion or injection treatments? Look no further. eMediate Infusion Center is here to make your experience easy and comfortable. At eMediate, we offer a wide range of services to meet your needs. From biologic medication infusion to chronic disease maintenance infusion, we have you covered. And to ensure your privacy and comfort, we provide private VIP suites for all our services. We believe in providing one-on-one personal care to every patient. Our team of experienced professionals has years of experience in infusion and injection administrations, ensuring that you receive the highest quality of care. Getting the care you need should be hassle-free. That's why we have a quick and effective referral process in place. We are open Monday through Friday from 8 a.m. to 4 p.m. We understand the importance of lab testing. That's why we offer lab draw services by Quest. You can easily get your testing done by appointment, saving you time and ensuring accurate results. We believe in making healthcare affordable. That's why we partnered with a specialty pharmacy, who process prescriptions at the lowest possible out-of-pocket cost, ensuring that you receive the medications you need without breaking the bank. Ready to experience easy and efficient infusion and injection treatments? Visit our website at www.eMediateinfusion.com or call us at 702-268-8647 to learn more about our services and schedule an appointment.
Medicaid is a government-sponsored health insurance program that provides medical coverage to eligible low-income individuals and families. Administered jointly by the federal government and state government, Medicaid aims to ensure that people who may not have financial means to afford healthcare services can access necessary medical care. So here are some points how Medicaid works. So eligibility determination. Each state sets its own eligibility criteria within federal guidelines. Eligibility is typically based on factors such as income, household size, disability status, and other factors. Children, pregnant women, parents, seniors, and people with disability may all qualify, but the specifics vary from state to state. So application process. Individuals who believe they might be eligible for Medicaid need to apply through the state's Medicaid agency. This can often be done online, over the phone, or in person at a local office. So coverage. Medicaid provides a comprehensive range of medical services, including doctor's visits, hospital stays, prescription drugs, preventive care, mental health services, and long-term care. States are required to cover certain mandatory services, and they have the option to provide additional services. Managed care. Some states use managed care organization to coordinate and deliver services. These managed care organizations contact with the state to manage healthcare services for Medicaid enrollees, ensuring that they receive the appropriate services and care. Next, we go to cost sharing. Medicaid typically involves minimal or no out-of-pocket costs for eligible individuals. However, some states may have nominal co-payments or premiums for certain services, particularly for higher income beneficiaries. Next, we go to dual eligibility. Some individuals are eligible for both Medicaid and Medicare, which is called dual eligible. In such cases, Medicaid can help cover Medicare premiums, co-payments, and deductibles, providing more comprehensive coverage. Next, we go to expansions. Some states have chosen to expand Medicaid under the Affordable Care Act, offering coverage to more low-income adults who previously didn't qualify for Medicaid. It's important to note that Medicaid offers differently in each state due to the flexibility given to states in designing their programs within the federal guidelines. Understanding your state's specific Medicaid rules and options is crucial when considering applying for this program. If you have limited income and resources, you may be able to get help from your state to pay your Medicare costs if you meet certain conditions. In most cases, you qualify for a Medicare savings program. You must have income and resources, which are below certain limits. States have different limits and ways of counting your income and resources. So of course, check with your state medical assistance or Medicaid office to see if you qualify. So there are 4 kinds of Medicare savings program. First is the qualified Medicare beneficiary. If you are eligible for the QMB, we call it QMB, Qualified Medicare Beneficiary Program, helps pay for your Part A and or Part B premiums. In addition, Medicare providers aren't allowed to bill you for services and items Medicare covers, including deductibles, co-insurance, and co-payments. If you get a bill for these charges, tell your provider or the debt collector that you're in the QMB program and can't be charged for Medicare deductibles, co-insurance, and co-payments. If you've already made a payment on the bill for services and items Medicare covers, you have the right to a refund. If you're in a Medicare Advantage plan, you should also contact the plan to ask them to stop the charges. In some cases, you may be billed small co-payment through Medicaid, of course, if one applies. Note, to make sure your provider knows you're in QMB program, show both Medicare and Medicaid or your QMB card each time you get care. If you have original Medicare, you can also give your provider a copy of your Medicare summary notice. Your MSN or Medicare summary notice will show you're on QMB program and shouldn't be billed. Then we go to specified low-income Medicare beneficiary, or we call it Slim B program. It helps pay for Part B premium only, okay? Then qualifying individual, or QI, we call it program, helps pay Part B premium only, while applications are granted on a first-come, first-served basis. Take note of that. Then we go to Qualified Disabled and Working Individuals Program, or QDWI. It helps pay for Part A premiums only. You may qualify for this program if you have a disability, you're working, and you lost your Social Security disability benefits and premium-free Part A because you returned to work. Promoting healthy aging is essential. I'm going to share a short video that can help you maintain a vibrant and fulfilling lifestyle as you journey through the years. Let's uncover the secrets to aging gracefully when thriving throughout the stage of our lives. Please watch it.
Welcome to Age with Grace. Promote essential healthy aging tips for seniors. Let's embrace the golden years with vitality and joy. Staying active is key to healthy aging. Engage in regular exercise like walking, yoga, or swimming to keep your body and mind in great shape. A balanced diet is essential for healthy aging. Fill your plate with nutrient-rich foods like fruits, vegetables, whole grains, and lean proteins. Getting enough sleep is crucial for your overall well-being. Aim for 7 to 8 hours of quality sleep each night to feel refreshed and rejuvenated. Maintaining social connections is important for healthy aging. Stay connected with friends, family, and community to foster a sense of belonging and happiness. Start your journey towards healthy aging today. Follow these essential tips and embrace the golden years with grace, vitality, and joy.
Now let's go to our Q&A segment. So question number 1, how often is Medicaid eligibility reviewed? Do beneficiaries need to reapply periodically? So annual renewal, Medicaid eligibility is typically reviewed periodically to ensure that individuals still meet the requirements for the program. The frequency of these reviews can vary based on several factors, including individual circumstances, the Medicaid category that all fall under the state regulations, So here are some of the general overview. First is the annual review. In many states, Medicaid beneficiaries are required to complete an annual renewal process. This involves submitting information about income, household size, and other relevant factors to determine ongoing eligibility. This annual renewal process helps ensure that individuals who continue to qualify for Medicaid can maintain their coverage. Then semi-annual or quarterly renewal. Some states have more frequent renewal cycles requiring beneficiary to provide updated information every 6 months or some every 3 months. Changes in circumstances. Medicaid beneficiaries are also typically required to report changes in circumstances as they occur. This could include changes in income, household composition, or other factors that might affect eligibility. Reporting changes promptly help ensure that individuals receive the appropriate level of assistance. So, automated renewal. Some states have implemented systems that use automated data sources to verify eligibility information, reducing the need for beneficiaries to provide manual updates. However, even in these cases, there can be periodic checks to confirm ongoing eligibility. Well, it is important for Medicaid beneficiaries to be proactive in providing accurate and up-to-date information to their state's Medicaid agency. Well, of course, failing to provide required information during the renewal process could lead to a loss of coverage. If you're unsure about the renewal process and the timeline in your state, it's advisable to contact your state's Medicaid agency or visit their website for specific information about renewal procedures and requirements.
Make your realty dream a reality. Discover Nevada real estate. Explore the stunning homes in Las Vegas, Henderson, Summerlin, and other parts of Nevada. Join Maria Garcia, a licensed Las Vegas realtor, as she takes you on a home hunting journey. Finding your dream location is my vocation is her commitment to her work and her clients. With her expertise and dedication, she will help you find your dream home and guide you through the process of making your wish a reality. Explore vibrant communities. Nevada offers a wide range of vibrant communities to suit every lifestyle. From the bustling streets of Las Vegas to the serene neighborhoods of Henderson and the luxury estates of Summerlin, there's something for everyone. Prepare to be amazed by the stunning homes in Nevada that will take your breath away. From sleek modern designs to elegant traditional styles, each home is a masterpiece. Get ready to find your dream home. Contact Maria Garcia at 310-926-4229. Maria Garcia is committed to fairness and equal opportunity in real estate. She is committed in treating every client with respect and professionalism. Maria Garcia is a proud member of the Las Vegas Realtors. This logo represents her dedication to upholding the highest standards of professionalism in the industry. Homes in Las Vegas, Henderson, Summerlin, and other parts of Nevada are not only adorable, but also affordable. Contact Maria Garcia at 310-926-4229, Nevada license number S0190131, your trusted Las Vegas realtor, and start your home hunting journey today.
Sadly, our time together has come to an end. I hope you enjoyed today's show as much as I did. I want to take a moment to express my heartfelt gratitude. First and foremost, a big thank you to my incredible production team whose hard work and dedication made this show possible. Your efforts behind the scenes truly shine through and have made a positive impact on countless seniors seeking vital information. I would like to extend a special thank you to my guests, Christian and Ron, for providing us valuable insights to our viewers regarding infusion therapy. As we delve into the world of Medicare and Medigap plans, I hope that the information I shared has brought clarity and peace of mind to those navigating their healthcare choices. Remember, knowledge is power, and understanding your options can pave the way for a healthier and more secure future. We encourage you to continue learning about the topics that impact your life and well-being. Lastly, thank you to my loyal viewers for joining us on this journey of senior information and care. Your trust and support mean the world to me. So join us again next time as we explore more compelling subjects that matter to you and to our community. So until then, take care, stay informed, and remember that together we can build a brighter future for our seniors. I would like to send my love, hugs, and kisses to all my clients. And to those who are looking for a reliable agent, I'm looking forward to becoming a part of your Medicare journey. This is Maria Garcia of MariaCares saying, take care of your health. That's the only one you got. Let's join hands to a better health.